Good day. My name is Amanda Smith, and I am the Development Director at Methodist Family Health in the Foundation. I want to thank you all so very much for inviting me here to speak with you all virtually. We greatly appreciate the opportunity to be able to talk about the services that we provide to the state of Arkansas. And I would just like to say thank you so very much for the support you all provide to us. Past support, current support, future support. Thank you so very much. We could not do what we do, and we cannot provide the services that we provide without the support and partnership of our community partners. So thank you very much on behalf of Methodist Family Health, the Foundation, and the clients and children in our care. Methodist Family Health is very large. We provide services to the entire state. We have over 500 employees and provide services to thousands of children and families yearly. We are 122 years old. We were originally started as an orphanage in 1899 by members of the Methodist Church. And so many people remember us and recall us by our original name, the Methodist Children's Home, and which was located on Fillmore Street in Little Rock, and actually still is. We have a brand new structure. It's new as of several years. It's a beautiful structure, and that exists on Fillmore Street. True orphanages, as they existed in 1899, don't exist anymore. And so the scope and services of what we offer, we have had to change to reflect the needs of the residents of our state and changing laws and legislations. The foundation, we are 17 years old, and we were put into place to support all Methodist Family Health programs across the state. Our mission is to give the best possible care to those who may need our help. And this looks different in different situations because every child and every family is different, and they're facing different yet similar struggles. So, as I said, we're a continuum of care, which is a really neat feature that we have because it keeps everyone in the loop on where a child is in their care, if they need a different care level. So it keeps all parties involved and on the same page regarding that child's care. So at Methodist Family Health, we offer inpatient psychiatric hospitalization for children ages 3 to 17. We offer outpatient counseling clinics, grief services, psychiatric residential treatment centers, therapeutic group homes, school-based counseling services. We have services embedded in schools. We have our therapeutic day treatment program for children in kindergarten through 12th grade. And we also have our Arkansas Cares program, which is for mothers with both substance abuse and mental health issues. So our hospital is located in Maumelle, and it is for children ages 5 to 18. And we have 60 beds. 24 of them are subacute. At the hospital, the kids that mainly come through there are considered acute. They have either voiced that they have intentions or want to harm themselves or somebody else. So going into the hospital, the need for care is immediate. Kids that come into the hospital are usually there for a shorter period of time, and a lot of times then thereafter they might be moved to one of our other facilities once they once they get stabilized. And that factors into us being a continuum of care. So they've received treatment at the hospital, they're stabilized, and then might possibly move to one of our other treatment facilities. We also have our residential treatment centers, and we have those located in Little Rock and Bono, which is outside of Jonesboro, and the kids are there about 120-ish days, give or take. We also have group homes throughout the state, and a lot of these kids are in the custody of DHS. They might have been in foster care, but might not have had a successful foster care experience for whatever reason. And so our group homes offer a place for these kids to come and live. And we have group homes in Magnolia, Little Rock, Helena. We also just recently opened in Fayetteville a transitional home, and this is for young men that are, they have aged out of the system, but they still need some additional help. And part of the criteria is either being in school and having a job, having transportation, be it a bike or a vehicle. And so that transitional group home is providing a service to those young men to still help give them additional support before being ultimately on their own. We have counseling clinics around the state. If you go to our website, methodistfamily.org, we have a list of all of the services that we provide and where our counseling clinics are located. And with counseling clinics, with outpatient care, that can be therapy for a variety of reasons that a child might need. Maybe it is mom and dad are going through a divorce. Maybe there is bullying going on. Maybe the child has a learning disability and needs a third party to talk to. We also have our day treatment program, and this is in Little Rock. It's on Aldersgate Road. It is a school setting. So in these cases, kids in their school setting where they had been attending, for whatever reason, aren't able to function. And so our school-based program buses kids in, and they have a school day on the campus that we provide. And in addition to receiving their school lessons so they don't get behind on their work, they also receive therapeutic treatment. And each child has a plan and a program, and the goal is to work through that plan, get the child back stabilized, and then get them back in their home school. We also have our Kaleidoscope Grief Center counseling program, and that is a service that we offer for families that have experienced loss, children that have experienced loss. They can come together with others who have similar life experiences and circumstances to be able to share and not feel so alone in their journey. We also have our Arkansas CARES program, and I mentioned this a little bit earlier, but our CARES program is located on our Fillmore campus as well, and it is for moms who have a dual diagnosis of a substance abuse problem and a mental health issue, and they are able to enroll in our program and keep their child with them. And so during the day, child goes to school or goes to the Head Start daycare program on campus, and then mom receives the needed therapy that she needs, receives treatment therapy, whether that's meeting with counselors, going to recovery classes and recovery programs. And then at the end of the day, mom and kids come back together and they have family time. They can eat dinner together, and mom can get child ready for bed, read stories. So it still keeps the family unit intact while mom is receiving treatment and therapy, and also other classes like parenting classes and working on parenting skills. So that's once again a really neat program that we offer. I know that's a lot of information. That's a lot of services that we provide. It's one end of the spectrum to the other. It's outpatient therapy to acute hospitalization and everything in between. Now I'm going to touch on the foundation, which is the area specifically where I work. We were put into place to support all of the Methodist Family Health programs across the state. Most of our funding for Methodist Family Health overall is from Medicaid and private pay insurance. Where the foundation comes in is we are the group that raises money and seeks out funds and in-kind donations for kind of the extra stuff, the extra stuff that can contribute to a child's care and their therapeutic journey. We raise money through grants. We raise money through individual donors. We raise money through special events. We raise money through church groups and congregations. We have a special event called Southern Silks. It's one of our fundraising events. It's a adult event, and we also have several campaigns that run throughout the year. We have our Get Up and Give campaign and our Christmas Share the Light campaign. Our Get Up and Give campaign, it runs during the Lenten season, and during that time we work with different churches and community groups and individuals to bring in-kind donations and also funds for our program. We have a large list of supplies that we continually need. Our Christmas campaign runs through Christmas, and that campaign is a way that we bring in a large chunk of funds that we raise throughout the year. So our Share the Light Christmas campaign is a very big endeavor, and we greatly appreciate all of the support that we receive during the Christmas season for our Share the Light. On the larger scale, we currently are in a fundraising campaign to raise funds for the new Spiritual Life Center that we are building on the Fillmore campus. And our Spiritual Life Center is going to be a multifunctional facility. Our Director of Pastoral Care will use it to do Bible study and group meetings with our kids. It will have some administrative offices. It will have a place to worship, a place for groups to meet. So we're really excited about our new Spiritual Life Center that is coming to fruition. Other examples of things that we have funded, we have funded the art program at the day treatment school. And then also I mentioned smaller things that still make a huge difference, like deodorant and toothpaste and paper towels. And we also have a couple of different funds that we support. We have our Bible fund, and our CEO, Andy Altum, believes it's very important for each child to be offered, if he or she would like it, a Bible. We also provide scholarships. Any child that has been in our care, and this is minus the hospital, but any child that has been in our care, when they are older, they are eligible for a $3,500 scholarship a semester from us. Thank you once again for the opportunity to be here today and to present Methodist Family Health and the services that we provide throughout the state. I know it's a lot of information, and if you ever want to know more or want specifics, please check out our website at methodistfamily.org. Because of your partnership and your past support, current support, future support, we are able to do our work around the state.